Service numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Join Dr. Leonard Suraj on Rev-Up St. Lucia 97.1 FM Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program delves into the science of various diseases, treatments and medical processes, and offers in-depth explanations to empower listeners and help ensure a better understanding of healthcare for all. So tune in on Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House with Dr. Leonard Suraj, only on Rev-Up St. Lucia 97.1 FM. Doctor in the House brought to you with the compliments of Laplace Salison, Ultramart and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient's safety comes first.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
Laplace Salison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Salison, of course. Laplace Salison, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
Welcome once again to Doctor in the House, and normally we have Dr. Leonard Suraj in studio, but tonight sitting in for Dr. Leonard Suraj is Dr. Tamara Remy. Dr. Remy, a very good evening to you and welcome once again.
Thank you. Thanks for having me again.
You're welcome.
Yes. So I think I need to replace Dr. Suraj because I think I'm doing this pretty often, right?
And I like the word pretty.
Pretty often, but it's always a pleasure. So just for this evening, Dr. Suraj is actually out, and so I'm holding down the fort. So yes, thanks again for having me on, Doctor in the House. And tonight we're going to speak about circulation problems. Yeah?
Okay.
It's always a challenge trying to find topics that can probably relate to the listening public. And I think I've suggested this before, that our listeners can probably send in some topics that they would really like to hear us speak about, that, you know, that they have burning questions about. And so I decided to choose something that everybody speaks about, and just to kind of make sure that we may all be on the same page. So I'm going to start with a question to you, Andre.
Sure. Mm-hmm.
When you hear about circulation problems, what's the first thing that you think about?
The circulatory system in the body, veins, that sort of thing.
Okay.
Yeah.
All right. So
heart, arteries.
The heart. Exactly. So for us, there are 3 separate circulatory systems. They're all working together, but when we speak about them and the problems that are associated with them, they're actually very different. So if we think about a delivery system, so it starts in one place. So let's say you've ordered something. You start in one place. The package that you've delivered has to follow a particular route to get to you. And then the delivery van has to return back to its station. Mm-hmm. And so our circulatory system and the problems that arise from them have problems that arise from where it originates, the path it takes to get to where the package is being delivered. And usually refer to those as the arteries. Mm-hmm. So the heart is the first place, the housing. And whenever it contracts, it sends fresh blood around to the body. So every organ and every cell in every organ gets nice fresh blood with oxygen, all the nutrients, etc., that it needs. And then on the other system, so the package is delivered, that's the food, the oxygen, etc. The other system, which is usually the vein system, has to now take, so almost like an empty truck, returning back up to the housing or back up to the heart. It now takes waste material, blood that has more carbon dioxide than oxygen, and in the veins takes all of this back up to the lungs and then to the heart. So if we think about the circulatory system, we recognize that you have the artery side and the vein side, and the things that affect them in some cases might be similar, but in other cases are very, very different. And the third system, which we don't really speak too much about, is our lymphatic system. Again, it's pretty microscopic, and so you're not going to be able to look on your hand and see the lymph vessels. You probably see them under a microscope, but mixed up with all of that lymphatic system will be things like your lymph nodes, right, which are part of your immune system. So the lymphatic system, again, we don't already talked too much about it, although we can see the effects of it when it's affected, has to do with a lot of clearance of inflammation, infection, those sorts of things that are always happening, whether the blood is going to cells or away from cells. So it's kind of difficult to choose which one is the most important, but I think the majority of people, when we talk about circulation, perhaps are referring to the artery system. Because when we speak about circulation, I think the first image that comes to people's minds is losing a leg with circulation problems.
Right.
The second image that may come to somebody's mind might be an ulcer that's just not healing, and that may be on the vein side. So in order to probably break it down, I'm going to try to separate them and speak about each of them. Circulatory problems affect or can affect any of our organs. Some of them are easier to detect. So for example, our eyes, right? You may see that your vision is fading. If you are consistent enough and go to your private doctor or your eye doctor, you will get your eyes checked, and you may see that you may need glasses, or when they do the special test that they do looking in the back of the eyes, they can see these changes. The other thing that we can easily see would be our legs. Now, more things affect our legs than they affect our hands and our arms. And that's because the circulation in the upper limbs or the arms, there's so many different ways and networks that blood can get around as compared to the limbs. Our limbs are longer than our arms, and the further away you go from the heart, the smaller the vessels get. And so our limbs tend to be affected more than our lower limbs than the upper limbs. And the number of blood vessels that we have that are carrying blood are a lot less than in the upper limb. Okay? So there's that. But we have to bear in mind that changes, if we can see changes in our eyes, if we can see changes in our legs, that the same changes are probably happening with our kidneys, with our brains, with the heart. And for men, even things like the changes in erections may sometimes be affected by our circulation, especially the arteries, because we're talking about blood flow to those areas. But we're going to focus more on things that we can actually see.
So when you say things we can actually see, you're speaking in terms of if there is a problem, this is the place it most likely will manifest itself.
That we can feel or see.
See, right? Okay, got you.
So
you're saying,
I mean, unless your kidneys have gotten to a point where, and that's usually end stage in terms of the damage that's been done to the kidneys, you're not gonna know. You know, you're not gonna feel when your kidneys are just beginning to get a little bit bad. Likewise, unless you're really paying attention to your heart, you may just miss a little bit of a chest pain or a little bit of racing of a heart, as compared to when you get a heart attack. When you get a heart attack, a lot of times it didn't just happen. It's been going on for a while, all the changes to the circulation. But when we speak about things like the limbs, if you start walking a particular distance, so if you have moderate circulatory problems in the lower limbs, if you're accustomed to walking, let's say from here to the top of lower ridge in Sunny Acres. All of a sudden now you have to stop because you have this ridiculous pain in the back of your calf. You have to stop. Once you stop, the pain goes away and then you can walk again. So you can see those changes. You can see that your muscles might be getting smaller. You may see that you're losing hair on the limbs. You may see changes to the color of the limbs. They're getting darker. And so you can see a lot of these changes. And likewise, when you go to the doctor, if they put their fingers on places where you expect to feel the pulsations, feel the heart beating, for want of a better term, then we can pick up that things are already beginning to change. As compared to things like more invasive, like an ultrasound and other tests, which we would have to do to detect them.
Let me just ask you a quick question.
Sure.
Normally we hear things like you don't see any signs. You just mentioned the kidneys for a while ago, right? You wouldn't really notice anything. But let me ask you as a doctor, I imagine you're a lot more sensitive to what's going on in your body. At least you're supposed to be, right? So if anything is going awry, no matter what it may be, wouldn't you, because you're so aware of your body, you make your health a priority. So when anything looks amiss, that you'd pick up and say, hey, that's a little strange. How come I have this thing appearing or feeling or whatever? Because I keep hearing that all the time, that you wouldn't really know per se, for example, if you're going to get a heart attack or a stroke. I mean, wouldn't there be something going on in your body that would indicate to you that something is
it's very true that hindsight is always 20/20, and a lot of people, especially and I can hear that especially in people who have things like cancers. Some things are very non-specific, but in retrospect you go, I was feeling tired.
Right. I did notice. Yes.
Our bodies are also pretty resilient, so unless our kidneys and our livers, etc., have been broken down or not functioning up to a certain point, like it takes a lot for your liver to start not working. So it will compensate and compensate until it really can't compensate anymore. So unless you're being diligent and doing your annual blood work, you're checking your urine just to make sure things that are not supposed to be able to pass through in the urine are not passing through. So unless you're doing things like that where you're actually looking and screening for changes, just based on how you feel in the early stages, you may not actually feel anything, no matter how in tune you are with your body. Things to do with the heart, you may not, again, the heart is going to pump and compensate until, the vessels are narrowing so much that the blood cannot get to where it needs to get in the heart, and then you'll have a heart attack.
Let me just give you a little example.
Sure.
Some time ago, I don't normally get headaches. I don't normally get headaches at all, right? But some time ago, I noticed I had this headache that wasn't kind of like going away for the day kind of thing. And I remember I was on the road and something just said to me, something, this is kind of strange. I don't normally get headaches. Let me just go check and see what's happening with my blood pressure, which I did. And it was elevated. It was at that time.
Right.
So that's what I was saying a while ago, that if we're in tune with our body, because I heard you say, and I've heard it so many times already, that you don't really get any signs per se, that sort of thing, until it's too late. Right. So I was just challenging and asking whether that is always the case.
Using your same example, there are lots of people who will not have a headache and their blood pressures are high.
Well, maybe they have something else.
Or maybe not, Again, the body is going to compensate. And that's one of the things that a lot of our patients who have high blood pressure will say, but I feel fine. And I can tell when my pressure is high. You may be able to tell when it's a lot higher than it's supposed to be. But if it's 150/90, you may be perfectly fine. It's when it reaches 170/100, then you may be like, okay, I have a headache. So it's really kind of trying to determine where along the spectrum you might be when you actually start getting signs and symptoms, because your body will compensate and make things move from normal to a little bit abnormal until it really can't compensate anymore.
Do you think that there are times when it would, as you said, trying to compensate, that you would actually feel okay without you even checking anything? You, for example, you're waiting to see if anything's going to be, will you feel any worse? Does the body sometimes, as you said, during the compensation period, that you seem to kind of go back to normal, and then that's why you probably ignore it?
I think so. I think so.
As I said, it's trying to compensate.
It does.
So, yeah.
It does. It's like,
So when you feel a little better, you say, okay, well, I'm all right
I'm
now.
all right now, and you kind of forget about it
Yes,
because
exactly.
either the body has compensated and brought things back to where they're supposed to be, or you now have a new normal.
Yes,
And
I
so you
understand.
get accustomed to that.
Yeah.
But that's the beauty of our bodies, what we call homeostasis. So it's bringing things to an optimal level, and the body will always try to restore things back to what it's supposed to be. And we get diseases, we get problems when it can't, right? Or when it has used up everything that it possibly can in an effort to try to get things back to normal.
Okay, I get you.
And so, I think when it comes to circulation problems, we have to, very much like what you're saying, be in tune with our bodies, because we do get clues a lot of the times. And in some cases, you can actually see them, right? And it's similar to, and I'm not even bringing cancer into my talk tonight. I always
But you
seem
can't- you
But
can't
I
help
always
it.
say those parts of our bodies where you can actually touch, feel, and go looking for things. If you do that, you pick them up earlier, right? So if we start with the arteries, so remember that's the side of the circulation that's coming straight from the heart. I usually tell my patients, just think of Wasco and think about the pipes that are coming into your house. So the big pipes, the big pipes are coming from a shed somewhere, and to get to each house, the pipes get smaller and smaller. So you have one main pipe that's coming into your house, and the one that's going to the kitchen is a little bit smaller, the one going to the bathroom. That's essentially how the heart and the arteries are. So coming straight off the heart, you have the biggest blood vessel called the aorta, which is nice and juicy. And as it goes further away from the heart, it divides and gets smaller and smaller and smaller. And so things that might cause a blockage, or things that may cause the circulation not to be as strong as it should, sometimes are related to the size of the blood vessels. So you can imagine if you have something that is 2 centimeters, right, in terms of the size of the blood vessel that blood can flow through, the amount of blood that can flow through there is a lot more than if it was 1 centimeter, half of that size. And so the size of the blood vessel is important. And that's why going from the thigh, the hip, and going down to your toes, the size of the blood vessels actually gets smaller and smaller. And so a lot of the diseases that affect the circulation will start off at the toes and then move up. And so when you go to your doctor, you will see when we're checking for your circulation that we put our fingers just on your foot, on the top part of your foot, because we're feeling to see if you can feel the bounding of your arteries, and then we move from there up to closer to your belly, looking for certain places to see if we can feel the circulation. Okay? The elasticity of the blood vessels is also important, right? So as you are younger, your everything is nice and tight, elastic. So even if the pressures from the heart are high, it can recoil. So it will cause the blood vessels to expand, but it will come right back. As you get older, it doesn't work as well, like most things, right? Our skin is not as nice and supple, as nice and tight as it used to be when we were younger. It's now a little bit more lax, okay? Same things happen with the vessels. And as we get older, so there are a few things that are automatically going to happen as we get older. And so those are risk factors for changes that happen in our arteries. So aging, I mean, we really can't do too much about that, right? And again, if you use the example of pipes in the house, when you buy a brand new house, the piping is nice and clean. You live in your house for 5 years, especially the kitchen pipes, things go down there, you use your things to get rid of all the gunk that's in the pipes, and most times you can get that flowing, but after a while, there's only so much you can do, and you may have to bypass because it's totally clogged. You may have to get a new set of piping, right? Unfortunately, a lot of our vessels, we can't just replace them with new piping. And so taking care of our vessels is important and kind of predicts later on how good they may be functioning in spite of the changes that happen just with age. So things like diabetes, things like high blood pressure, things like tobacco, smoking, are all risk factors for plaques being deposited inside of the vessels, and that also contributes to the narrowing of the vessels. So a lot of the changes that we see with circulation that have to do with the arteries are because of the development of plaques, right? So again, we can equate plaques with the gunk in our pipes, and so the amount of blood, the amount of water that can flow through those pipes is going to be reduced.
So can I just ask quickly then,
Sure.
how do we get the plaque?
Again, things like the most common is our high cholesterol. So cholesterol causes deposits. It has a whole reaction with the lining of our blood vessels. High blood pressure sometimes can cause damage to the lining of the blood vessels. So there are a combination of things that can happen that can lead to these plaques being deposited. So high cholesterol.
So that would come primarily from what animal products, or where does it come from?
A lot of things that we eat that have a lot of additional cholesterol and fatty stuff in there, right? And so that's why eating properly, exercising, all of those things are thought to be preventative. And we focus a lot of those same language when we're talking about high blood pressure, diabetes, etc., because atherosclerosis, or those plaques, is at the center of all of these diseases and how they affect our arteries.
Can you repeat that? The plaque is at the center.
Atherosclerosis, which is a development of plaques, so that the lining, the inside of our arteries are no longer nice and smooth, but deposits of plaques are found there. That is essential to a lot of our problems and complications that we see with diabetes, high blood pressure, those chronic diseases. Okay? And so when we recommend, when we test regularly your cholesterol, and when we recommend that you are on medications that address the high cholesterol, when we suggest that your diet changes to address the high cholesterol, we're trying to stop the progression of the plaques and all of the complications of the plaques. It's very rarely that you have a reversal, but we try to halt what's already happening with the lining and what's happening with the vessels.
So you said a while ago that you as a doctor now would recommend to your patient who is going through the atherosclerosis situation that they change certain things. So I'm just curious to know, wouldn't that advice be good in general?
It definitely is. It definitely is. And so
what would you, I'm curious to know, what would you tell your patient who has an issue with plaque, extreme plaque in the arteries?
So we're not going to know. Again, we test. Let me see what's the best way. Unless we go doing certain studies that inject dye into the system, the circulation, and look at the distribution of the dye in the vessels, where you can actually see, especially with the bigger vessels, that it's narrowed or that it's irregular. You may not always know which patients have plaques or atherosclerosis or the severity,
Really?
unless you go investigating. However, like we were saying, we have certain organs where you can begin to see some of the changes, right? So with mild disease, moderate disease, and severe disease, there's a direct correlation to the amount of narrowing, etc., of the blood vessels. But you may not be able to document that, okay, this vessel has a plaque, the other one. Like just routinely, if somebody comes with a heart attack, when you do their special scans and when you do an angiogram, you're actually looking at each of the vessels and you can detect which ones have cut off, which ones have very poor flow. But that's usually after you've had a heart attack.
I was just about asking that question.
So we don't go doing angiograms routinely on everybody. I mean, if you meet certain criteria, even before you've had a heart attack, then yes, we can do an angiogram. That's part of your workup. A certain age, certain risk factors, a certain profile. But the general public is not going to be the target for, okay, we're going to send everybody for an angiogram or send everybody for testing just to see how much atherosclerosis they have. If we do your cholesterol and it's high, we can most likely say that you are at high risk for getting atherosclerosis. And so empirically, before you get any of these complications, we can try to lower the cholesterol. It doesn't mean that we're going to reverse the plaques that are already there, but certainly try to prevent any further narrowing or complications in the blood vessels.
Mm-hmm. So you're saying mainly these plaques are caused by lifestyle?
A lot of them, yes.
Like
a lot of our chronic diseases, right, are caused by lifestyle.
You mentioned earlier what smoking,
diabetes, high blood pressure, lack of exercise, so a sedentary sort of lifestyle. Alcohol is always in there, but tobacco is, we know for sure tobacco is a major risk factor. So all of these actually contribute to the formation of atherosclerosis or plaques.
But you're saying usually the way you diagnose whether somebody has, that's a very difficult word to pronounce, atherosclerosis. Is if the thing, they already have a problem and they come to you and then you kind of figure it out. But before that, you're saying basically you can't really.
You may not have enough symptoms because there's mild, moderate, and severe disease.
Yes.
Right? So preemptively, there are tests we can do, but it's not just like a standard. You go and do a blood count and say, okay, you have atherosclerosis.
I get you.
Okay, but certain things will point to damage already beginning, most likely because of poor circulation, and that poor circulation is most likely because of the atherosclerosis.
So you're saying all these diseases like the high blood pressure, diabetes and so on, is because of the problem with the plaque and so on?
No, and what I'm saying is that a lot of these have associated atherosclerosis. So there are risk factors for atherosclerosis. Right? So when you have diabetes, when you have high blood pressure, so whether it's the egg before the chicken before, especially with the hypertension. So sometimes it's the narrowing that will sometimes cause you to have kidney problems that may cause high blood pressure. It may be the other way around. The high blood pressure is what's causing the damage to the blood vessels in certain cases. Yeah.
Wow. Amazing.
Yeah.
Okay, let me just give you a little break for a few minutes.
No problem.
Yes, and just remind our listeners and our viewers that this is Doctor in the House, and we have with us Dr. Tamara Remy sitting in for Dr. Leonard Suraj. The show brought to you the compliments of Laplace Salazon, Ultramart, and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient safety comes first.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
Laplace Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Salazon, of course. Laplace Salazon, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
This is Doctor in the House live with Dr. Tamara Remy sitting in for Dr. Leonard Suraj. And just like to remind you, if you'd like to call us, the number, the fixed line is 572-9710. Fixed line is 572-9710. Or you can WhatsApp 287-0971. WhatsApp is 287-0971 if you have any questions for Dr. Remy. Again, the fixed line is 572-9710, or you can WhatsApp 287-0971. Back to you, Dr. Remy.
Okay. So we did all of the groundwork.
We actually have
So
a
in
call.
term-
Sorry to disturb you. I'm sorry to
okay.
disturb you.
Sure.
Just use the headphone so we can take the first call. Yes.
Hello, good evening.
Doc. Good evening, Andre.
Good evening, sir. How are you?
Fine, thank you. Thanks for accepting my call. Huh?
You're welcome.
No problem.
Okay. Doc, you talk about the aorta. That's the biggest blood vessels in the body. Huh?
Yes, it is.
Okay. Now, to every organ, is there the arteries, are they all the same size?
No, they're not.
Different organ, different size of artery.
Yes. And in some cases, even the number of arteries that are going to the organ.
Okay, so let's look at the kidney.
Mm-hmm.
If you have a kidney failure,
Mm-hmm.
is it that oxygen is coming there or food is coming there? Or food is coming there, but the vein are not taking out the waste? That's why you're having organ failure. I mean, organ, it doesn't have to be the kidney.
So if you have
All right,
kidney, go ahead. You wanted to say something first?
Okay, let me try to put it a little easier so you can understand. You have the artery supposed to bring oxygen or food to an organ,
Mm-hmm.
and the vein supposed to remove the waste.
Right.
Hmm?
Yes.
Okay, so if you have an organ failure, I want to know, is it that food or oxygen are not getting there, or the vein is not taking out the waste? That's why you have the failure.
Okay. So
That's my question.
that's your question. No problem. So when you have an organ, there are different reasons why your organ might fail. One, which we're talking about, is the circulation. So the amount of blood that is supposed to bring all the nourishment, whether it's the oxygen, the food, everything else to that organ is not working properly. It's not bringing enough. That might eventually cause some of the cells in that organ to die because it's not receiving enough of the blood supply. So that's one reason. Less likely is the ability for the veins, which is again just a vessel, to take all of the blood that has, given off all of the oxygen and the food, and now is taking not waste as in urine, etc., but waste as in carbon dioxide, the things that the cells breathe out so that it can go back up to the lungs. But remember, you have the organ itself. So if we're using the example of the kidneys, and the kidney acts like a strainer, so it excretes certain things that the body doesn't need. It filters certain things so that the blood is kind of cleaned. That's one of the organs that does that. And you can have damage to the kidney itself that is unrelated at all to the blood supply. You can have infections. You can have medications that you might have taken that are destroying the cells. There's so many different reasons in addition to just the circulation that may lead to kidney failure or organ failure. So it doesn't always mean that the blood coming in is not reaching or the blood leaving is not leaving properly, but there are lots of reasons. But circulation for sure, especially with the kidneys, can contribute and or can be the reason why you can get failure. But it's just one of the reasons why you can get failure of the kidney. Okay, but it's because the cells, in order for the kidney to function properly, the cells are not getting the nourishment that they need, and so they're unable to work properly. And so you have a kidney, it starts to shrink in size because it's not getting all the food it needs, and then the function starts to deteriorate when we talk about the circulation part. But just a reminder that there are other reasons why the kidney might fail.
Okay. He hung up. So,
Okay.
yes.
So
Yeah.
I hope that answered.
Yes.
Yeah. Okay. So so we spoke about, the theory part of it, but in terms of the practicality. So when we speak to our patients, and when we actually see our patients, as I think I mentioned before, there is the difference in severity. An astute clinician, if you see a patient once a year, should be able to pick up early changes with circulation with your arteries. And I think most patients who are diabetic, hypertensive, have high cholesterol, etc. So the risk factors that we know, we should be paying more attention to examining their circulatory system. Okay, and it requires just something as simple as touching to see if we can feel the pulses bounding. Okay, so there's a certain strength with which our pulses should be felt that will clue us in as to whether it's normal or abnormal. And then based on that, we can decide which other tests we need to do to confirm. There are standard things that we do that give us actual grading from mild, moderate, and severe. But like I said before, sometimes the patients come in and they're complaining of different symptoms.
Hold your thought.
Sure.
We have another call. Yes. So
I guess I should keep on the headphones. Hello, good evening.
Hi, good evening.
Good evening.
Wonderful conversation.
Thank you.
good evening, sir.
Very good evening, doctor.
Yes, Dr. Remy.
Dr. Tamara, how are you?
I am well, thank you. How are you?
Oh, okay, I'm brilliant. I'm great. Just want to add my 2 cents to the conversation. That's okay?
Sure, no problem.
All right. I listened to you very, very well. And what I heard you said to the caller previously, that sometimes bad medication in the system could cause some damages. You know, there's certain medication which I don't know if it just, well, with my ignorance, I don't know if it's, for instance, I would say because of the severity of the medication. For instance, ibuprofen, it's not supposed to be taken on an empty stomach, if I'm correct. No?
Usually advised to take it with food, or at least with your, yes.
Right. That means that it's a very, I would say, severe drug or strong drug. Just like Panadol, like you could take on an empty stomach, it's much mild, if I'm correct.
Well, they work in different ways, so I think that's more the reason why the difference in how to take them.
Just suppose, caller. Yeah, I often wondered, why is it that some medications need to be taken with food?
Sometimes it has to do with something has to do. So if you're speaking about pain medication, that's might be a different reason to antibiotics on how you take them, which foods you avoid. Sometimes it just has to do with the reactions and how it's absorbed. Certainly with what we call NSAIDs, that's the Voltaren, the ibuprofen, that class of drugs, because of the way that they work in terms of with acid, etc. It's usually we try not to erode the lining of the stomach with chronic use, because we do have a barrier on the lining of the stomach that helps to protect the stomach. And the way that some of these medications work is actually by reducing that lining, that barrier.
Understood.
Right? Yes. Whereas paracetamol, Panadol works on in a completely different way. And so the side effects or the effects are not the same.
Okay.
So they all have different pathways, and so if you know what the pathways are, then you know what to expect.
Sorry for disturbing you, caller. Sorry. Carry on.
Yes, I think Andrew just took some of the things that I was just about to speak up. Yeah, because it's okay. It's okay. Nothing wrong with that. Because I on that subject, I would like to be kind of the devil advocate. Why? Because if certain things not supposed, okay, for instance, let me go direct into it. For toothpaste, it has fluoride. Now, to me, I know that when I read up on it, fluoride is not healthy for the body. And I have used some analysis. I'm brushing my teeth, but what I do, I try to do it in a way like almost outside, just for me to prove a point where wherever I'm spitting out the rest of the fluoride, the toothpaste and everything on the grass. If you check, anybody can try it. You know the grass is not growing there.
Okay. I have not tried that.
Oh, okay. I'm just, so try it. Don't take my word for it. Like Andre would say, do your research, whatever. At the end of the day, fluoride, you know to yourself, I know fluoride is not healthy for the body. This is why if something is in your mouth, for instance, you're brushing your teeth, and it says that on the box, it says, it caution, it says the children not supposed to be brushing their teeth certain age because they need to throw. You can't swallow. Children like the sweet stuff because what happens is like candy kind of flavored. Remember, because to you know that the toothpaste is like flavored for the children, right?
Mm-hmm.
So that it will be easier for them to use. So at the end of the day, it says on the box that you're not supposed to swallow. So to me, if something is so, I would say so precautious, why scientists or the dental fraternities or the health fraternities like try to use something much better or less harsher? For instance, I'm just diverting into the water. This like chlorine. Chlorine is so harsh on your body in the inside, and sometimes even the water is bubbly. It's so strong because when I let it settle, when you smell it, it's like pure bleach or chlorine. To me, the scientists could use something less harsher on us as human beings. Certain things, this is why some people will tell you they'll stay away from this, stay away from that, because as you teaching us right now, the things as we could do or don't do to better our health. Okay, so I'll stay. I'll stay on the line if you want me to, or I'll just hang up.
Okay, so a couple of things. When I mentioned about medications and the kidney, I don't know that I said bad medications. Some of us have reactions to medications, and sometimes the medications that are given for a reason can sometimes have a side effect, which we sometimes know of. So I don't think knowingly anybody is going to put a patient on a medication that we know is going to cause kidney disease. But chronic use, and that's why, I'm always baffled, although I understand why, when we see ads on TV for medications, 30 seconds is about all the benefits of it, and another 2 minutes is all the side effects. It may cause death, it may cause X, Y, and Z. So there's a disclaimer that explains all of the things that may or may not happen. And for us, it's always trying to decide the benefits of something versus the risks. And I don't know that there are very many medications or things in life in general that only come with benefits. And certainly when we're making medications, there's an aim to treat something. Sometimes you get an additional benefit, and sometimes you get the side effects, which just based on the compound, based on what it is you're putting into that medication. I mean, one can argue we are prescribing antibiotics, which 100 years ago we didn't have. People were dying from infections. Now people are hardly dying from some of the infections because we have really good antibiotics. But we know that the antibiotics will have some side effects. So do we not give the antibiotics to save lives and get rid of an infection because there's a potential for side effects? Do we weigh the two, the benefits versus the risks? And unfortunately, a lot of medication, unless there's completely natural, where we know all the dosages, where we know, for each patient what is going to work, just about everything I think carries the chance of having a side effect or a complication. And unfortunately, when medicine progresses, the benefits for a lot of things, not all, tend to outweigh some of the side effects or the risks. So, does that make us stop prescribing? One thing with the fluoride, I think it more has to do with the effects on growing children's teeth, the staining of the teeth, and usually that's why it's not recommended for kids. The no swallowing is for all of us, adults or child. But the fluoride, use of fluoride or avoidance of fluoride with children really has to do with, because it can stain their teeth because their teeth are still developing, and that's the side effect of the fluoride for kids. But your point is taken, but I don't know that there's going to be any medication with benefits that may not have a side effect. And I think patients, all of the medications come with that disclaimer, or at least that information, what you can expect. And at the end of the day, it's a choice.
So going back to his question.
Doctor, sorry.
One second, Anthony. I'll keep you there. Just 1 second. So are you saying that even, because you spoke about science and so on, scientists, why don't they do something a lot milder? Mm-hmm. Even if they come with something milder, I think I understand you saying there would still be some sort of side effect, no?
Well, when we give medications, we're using the dosage that is going to give the desired effect. So you may get something with 25 milligrams versus 50 milligrams, but you start off at 25. It's not working, you go up. But you understand with the incremental, increase, what is also increasing.
Yes.
But I think when you start the medication, in order to have the desired effect, it has to be at a certain level. That's where you get the effects that you want.
Yes.
So just to reduce it, because for various reasons,
better tasting
you may not. And so there's a lot of research, I think, continuously being done. And there are a lot of lessons, I think, that we're learning from pharmaceuticals, benefits versus risk. Some things are completely taken off a shelf, and some things you continue to make them better. So I think, like with most things with research and science, the longer you are with something, also the longer that you get to see the long-term effects that you may not have seen after 5 years, but you start to see them after 30. And so it's a continuously changing thing. And so the advice that we give people and we stick to now may be completely thrown out in the next 5 to 10 years. And that's the thing with medicine.
The call is still there. Anthony, you want to continue?
Yes, Dr. Remy, one more thing.
Sure.
Just adding to the toothpaste. It says that if swallowed, you have to be rushed to a poison center or whatever. So I'm just saying, why you have to, use something, and then if you swallow it, like a place that's so sensitive, like your teeth or your mouth, and you have to be rushing, because it says so. I read it on the box, because it's good to read. So this is where you're getting information. So it just probably have some ingestion or something that's not, like if you swallow it, you're gonna. So they said that to rush the person to a poison center or so that
you swallow toothpaste.
Yes, that's what it's written on the box. No, I'm just telling you, it's because just like Andrew said, once that the Vic's supposed to be for your oral, like from the outside of the body, but these grandmother is put it on their tongue or whatever. So I'm just telling you. So I'm just telling you, what it is. So I'll still listen. Thank you so very much. A very important subject.
And thanks for calling. So if I understand you correctly, Dr. Rim, you're saying the medication has to be a certain strength so that it can address the problem at hand. The
problem that it's there for.
Yes, okay, all right, I got you. And I guess, as you said, there with the strength now comes the certain side effects as a result.
Exactly. Yes, if you exceed that, now when we speak about medications and kidney disease, sometimes the continuous use of medications, just because of how they're excreted, etc., can put your kidneys at risk. So there are some medication, and it's usually written that it should not be used for these are the side effects, etc. And you have somebody who has a lot of pain, they're going to continue to take the medication at the risk of getting an ulcer, at the risk of kidney disease, at the risk of all of these things.
You have another
but
caller?
It's not designed for that.
Okay. Good evening.
Oh, okay. Good evening.
Hey. Good evening, Doc. Good evening, Andre.
Yes.
Good night.
Welcome back.
Thanks for accepting my call.
You're welcome.
Doc, we're talking about circulation, and the heart, you can say, is like a crankshaft.
A what, sorry?
A crankshaft? Andre, you know what's a crankshaft?
Of course I do. I don't think the good doctor would know about that kind of stuff.
Enlighten me, please. I'm listening. Go ahead.
This is the organ that pump blood all over the body.
Yes.
And we've been hearing that the human body is made of cells, okay? And then, if it's so, why, from a doctor point of view, why we never hear about heart cancer? Because they say we have cancer cells all over our body, and the heart pump blood to organs that have cancer and whatever. Why we never hear about heart cancer?
That's a good question.
There is heart cancer.
There is?
There is heart cancer. Any cell in your body can develop cancer. It's not very, very common. And we also see secondary cancers affecting the heart. So we have patients who will come with a lot of fluid around their heart, or the heart not working properly, and when we diagnose them, it's because they have cancer cells lining the heart and the sac around the heart that's not allowing it to function properly. So there are cancers of the heart that are primarily starting in the heart, but we also have those where the cells go and they leave where they've started and they go and live in the heart. So they're not of the heart, but they are deposits in the heart. So we do, but it's not very, very common. Certainly not as common as the other ones that we speak about.
That's interesting.
Just about any cell in your body can have cancer.
Can have cancer. And my last question, Doc.
Sure.
Doc, what really caused the failure of the heart valve? Yeah, I'll listen.
Oh, there are a lot of reasons.
Thank you.
Right? There are a lot of reasons. So there are things that you can be born with, that your valve is not functioning properly from you're born. And so there are some babies, even before they actually come out of their mommy's womb, we can tell that they're going to have a problem just based on how the heart looks. It's enlarged, it's not functioning properly. When they're born, they're blue, they're unable to get enough oxygen out. And then you have other things. You have things like infections that circulate in the body and deposit on the valves, and then they cause a problem with the valves, because your valve is supposed to be able to open and close and allow blood to go just in one direction. And so that's another reason. You can have certain disease processes that cause inflammation, and the heart and the valves are affected. You can have any of those things. You can have clots that either arise from the valves or get deposited there, and so they cause a problem with the valves. So there are lots of reasons why you can get problems with your valves that don't allow them to work properly. So they're either congenital or things that, as you live your life, develop as a consequence of all of these things that I just mentioned. Okay?
Yes.
All right. So in terms of the mild, the moderate, the severe, we're still on the arteries there. We haven't reached veins yet. So we're just going to try to wrap up the arteries. Mm-hmm. So for persons who might have diabetes, high blood pressure, high cholesterol, the things that you need to look out for. So if you're accustomed to walking a certain distance, you notice that you have really bad pain in your calves. That will go away as soon as you stop walking that distance. You take a break. And you can resume and walk for the same distance again. Chances are there's something going on with your circulation. So as you walk, your muscles require more food, more oxygen, the cells in the muscles. And when they get deprived of this, maybe because the circulation is not as it should be. Now, we're not talking about people who are just not fit, right? We're talking about severe pain in the calf that makes you have to stop, and then the pain goes away. You probably need to get your circulation checked by a doctor. The other things you can look for, if you notice that especially the legs, they're changing color, they're getting darker. You notice you don't have as much hair, it's shiny. You might be losing all the muscle mass that you had before. Chances are it may be something to do with the circulation, so you should also get that checked out. If your wounds are you get a little cut and it's taking forever to heal, or just not healing at all, you probably have a problem with your circulation. Now, sometimes the discoloration is difficult to differentiate between the artery side and the vein side. And I'm sure a lot of us know what the veins problems look like, right? The first thing that you will see are varicose veins. So people have varicose veins. Those are the bulging veins that you see underneath the skin. That's on the other side of the circulation, okay? Remember, a lot of us are walking around, standing up, doing our jobs. Our bodies have to push a lot of energy to get the blood from our feet back up to our hearts. So long standing, okay, is a contributor sometimes to our veins problems. But sometimes what you will see is the change in the color of the limbs. They get darker, the skin gets thicker and tighter. At the end of the day, you may see some swelling in the limbs, and you'll say, when I lie down, when I wake up in the morning, all the swelling is gone. But at the end of each day, my legs feel very tight, uncomfortable. You may see the varicose veins. Sometimes you don't have to see the varicose veins. Those might all be signs of veins problems, which might be different to the arteries. And the artery, you can understand, has to do with blood going to the vessels. So anytime the muscles have to work, they start to pain, and you see the problems with the more energy and the more work your muscles have to do, because the blood supply to them is not as good as it should be. And just one thing I want to say, a lot of older people cannot sleep at night because they have pain in their legs. They cannot find a comfortable position. So they're not walking and getting this pain. They're just at rest. Sometimes that is a sign for us of poor circulation. Because even at rest, when the muscles don't need that much energy, you don't have enough circulation to supply them. All right, so in terms of the veins now.
I'm just curious, where the varicose veins are concerned, are those people in pain when they have this issue?
Veins?
Yes.
Most times, no. What they describe is just a heaviness and a discomfort, an achiness to the limbs, just because it feels tight. Because remember, the blood has to find a way, has to go back up to the heart. Okay? So with the veins now, it's a little bit different. If you look on your hand, you can see your veins. These are the superficial ones, the ones under the skin. They serve a purpose because they drain everything, but the important ones are the ones we cannot see, which are deeper. So they're in the muscles between our calves, and when our calf muscle contracts, that's what helps to push the blood up to our heart. And there are other things that our bodies have been made in a particular way to accommodate for that allow the pressures to get the blood back up to the heart. So with our veins, it's only supposed to go in one direction, back up to the heart. So all the valves that are in our veins are pointing in one direction and allowing blood to go in one direction. So there are things that can happen that prevent the blood from going in that one direction. Some of us have a genetic predisposition. So they will say that my mother have veins, my sister, everybody in my family have veins. It's a family thing. So sometimes the valves themselves are genetically not functioning properly. Long-standing people who have clots in the deeper veins, remember the veins are draining blood from under the skin to the deeper ones, and then the deeper ones are what going up to the heart. If you have a clot, a blood clot in your deep veins, that's preventing blood from going in the direction, and so the blood gets backed up. And so the superficial ones under the skin start to get full and bulge, and that's how you get varicose veins. Not only because of clots, but because the blood flow is now going in the wrong direction.
So before we end, Dr. Remy, can you just give us, I don't know, I mean, it's probably a very, very difficult thing to do, but can you just leave us with something we can take home and say, all right, let me do such and such a thing to try to avoid those problems with my veins and arteries and whatever else you spoke about earlier. Is there anything that we can do?
You know, our conversations, whether it's me, whether it's Dr. Siraj or any of the other doctors, are always going to be centered around prevention and healthy lifestyles. Okay? So circulation is no different to just every other disease in terms of how do we prevent these things. And as it pertains to circulatory, it's about maintaining an ideal weight. It's about exercising. It's about making sure that we get our tests done to make sure we don't have high cholesterol, checking to see if we're diabetic. And if we are diabetic, making sure that our blood sugars are under control, our blood pressures are under control. For things like the veins, paying attention, you can see the varicosities, you can see the varicose veins. Exercising helps with that. If you do notice that you have varicose veins, things like wearing your support stockings, things like eating what you're supposed to be eating. So a lot of that conversation, I think we've just added another thing that not doing a healthy lifestyle can contribute to.
Right.
And so I think the continuous conversation about the eating healthy, the exercise, avoiding tobacco, going for your annual screening, and paying attention to your body. Stand up in the mirror and look. And as you said, there are signs that you can sometimes get if you pay attention to your body that you may just disregard. But you need to be in tune with your body because there are some signs and symptoms that your body will show you.
And I noticed, of course, you mentioned some other issues like the diabetes and the high blood pressure and so on. And you're saying they're connected to the issue of the plaques and so on. But you said sometimes it could be the plaque causing the problem or the diabetes causing that sort of thing. But the lifestyle that you're talking about, would it help to address all these problems?
Definitely. And I'll give you the simplest thing, that all of these changes, when we do postmortems and look at the aorta and look at the blood vessels and see these plaques, we're now seeing them in younger and younger kids. So all of these changes are actually beginning in preteens.
Wow.
which is very scary, which means that by the time they get to 20 and 30, they will have all of these chronic diseases. They will be at risk for all of these things that 60 and 70-year-olds, 60 and 70, are the main ones who are being affected.
Mm-hmm.
And so lifestyle, for sure, is playing a huge role. Again, I'm never going to stop advocating. Our kids, 1 in 3 are obese. They're living
in St. Lucia? 1 in 3?
Caribbean, yes, 1 in 3. Our kids are not as active as we were when we were in school. Everybody, their fingers are active because they're on a device. Our kids are a lot bigger than we were when we were in school.
Mm-hmm.
The after school or even lunchtime activities, running around the school, we don't see them doing that half as much. And so all of these things that we're talking about are being accelerated. We're seeing them in younger and younger people, and they can be prevented.
Now, just a quick, just an observation as you mentioned that. In my days in primary school,
Mm-hmm.
I mean, you'd know there's a school around.
Exactly.
You would know because we're always running all over the place and playing games and whatever, and you know there's a school. I find now you pass in a school zone, you say, wow.
Don't know.
You swear that's some bodily or something.
It's very true.
It's quiet,
it is very
quiet,
true.
quiet.
I mean, all of us at lunchtime, you went back to the class after lunch, missing a button, playing bullseye.
That's right.
I mean, you were that's what you look forward to in school. There was nothing else. Even after school, you were out on the block or doing something else, but that's not happening right now. And so we're going to see the effects of it. I mean, we're talking about chronic diseases and things that really should be affecting just our older populations, but our young kids are feeling all of these effects.
Wow. Okay. All right. Dr. Remy did a good job as always.
Thanks for having me. Thank you for having me. And hope to see you all soon.
And thank you for being here with us. We really appreciate you holding on sitting in for Dr. Suraj. And I don't know how soon we'll see you again.
I don't know. We always have this conversation. We always end on this conversation.
Exactly.
But again, I'd like to appeal to your listeners. Send us some topics you'd really like us to discuss.
Mm-hmm.
We'll find the appropriate persons and yes.
Yes. Okay. So thank you very much, Dr. Tamara Remy. Thank you.
Andrew.
All right. You've been listening to and viewing on Facebook, YouTube, and X, Doctor in the House. And we'll be having another program next week, Tuesday, same time from 6 p.m. to 7 p.m. right here on Rev-Up St. Lucia, brought to you with the compliments of La Place Salaison, Ultramart, and Tapillon Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive